Hello, my name is Jalen Payne, and today I'll be presenting a project, a PowerPoint I made on the national opioid crisis. It will be set up on my laptop, and I'll show you every slide after I present it, okay? All right, so this, like I said, this is the title slide, National Opioid Crisis by Jalen Payne. Some of the objectives include the learner knowing just general information about the national opioid crisis. By the end of this presentation, the learner will know how opioids work throughout the body and the brain. And by the end of this presentation, the learner will also know what medicines work against opioid overuse or overdose. Here's some of the objectives. All right, first off, to know what we're dealing with in this national opioid crisis, we have to know what an opioid is. So I've defined that as any of a group of naturally occurring peptides, also artificially occurring, made in the lab, that bind at or influence opioid receptors. Opioids include the illegal drug heroin. You can have synthetic opioids such as fentanyl and pain relievers available legally by prescription. These can include Oxycontin, hydrocodone, codeine, morphine, and many others. And here's the slide. I may back up a little bit. Okay. All right, some uses for opioids are, of course, pain relief, but did you know they're also anesthesia? Did you know that opioids also suppress diarrhea? They can suppress cough, and they can also provide replacement therapy. All right, here go the uses. That's that slide. All right, so now what we're gonna focus on is opioids' effects on the brain, okay? Now, opioids create artificial endorphins in the brain, amplifying positive feelings and euphoria. They really affect dopamine. Opioids can trigger a big release of dopamine, which gives the user a euphoric high that they tend to look for and want. Okay, the artificial endorphins they mainly influence are called dopamines, as we just mentioned. These dopamine increase joy, happiness, and positivity within that person. The problem is that an addict may overdose chasing that euphoria. That is the big problem, because it's just going to take it more and more and more because you're getting that good rush, okay? And here's that slide. Now, the national opioid crisis is explained as an epidemic of drug-seeking people, but not just any drug, the opioid. This has led people to come into the emergency room and break their own bones. Some, just complaining of pain, drug-seeking behaviors. They could be faking, say it's this limb and grab this other limb. All right. And some of the financial numbers impact on healthcare. We're just going to read off some of those numbers. The report estimates that the crisis cost the country $631 billion between 2015 and 2018. Of that total, $253 billion can be attributed directly to mortality costs, $205 billion to healthcare costs, and $96 billion to lost productivity. Criminal justice costs also added up to $39 billion, while child and family assistance and education costs ran to $34 and $5 billion respectively. In 2017, the total cost was estimated at $171 billion, while it was higher in 2018 at $179 billion. So as you can see, every year that this epidemic occurs, this national opioid crisis occurs, it's going to cost our country upwards almost to $200 billion every year, which is, another reason why we have to stop it. Now, the impact on healthcare. Our emergency system becomes strained due to the increased calls because of drug overdoses. This takes our attention away from more serious, well, not more serious, but serious acute episodes such as stroke, heart attack, and things such as that. It means we have less time to care for those patients. The epidemic results in higher insurance costs on everyone as a whole. So insurance costs are going up because of the opioid epidemic to help recover the costs that are lost through medical supply. Here's that one, that slide. Okay. Now, signs and symptoms of opioid abuse. If you see these signs and symptoms, you may want to get that person some help fairly quickly. You're going to see dizziness, constipation, lethargic, depression. You may see some immune dysfunction. All right. So opioid withdrawal signs and symptoms. So someone who's going through withdrawal symptoms, you may see them, and they may have to get what you call some artificial opioids to come if they're in bad enough shape. The body literally craves for these opioids, and they can die if they don't get them. So they're all set with what you would say a minimal dose. All right, so withdrawal signs and symptoms include anxiety, rhinorrhea, mydriasis, nausea and vomiting, abdominal pain, tachycardia, and hypertension. Now some treatment. 1,000 patients are treated daily by emergency departments for misuse of prescription opioids. This is just prescription opioids, not the street drugs. Methadone and buprenorphine can decrease withdrawal symptoms and cravings. They work by setting on the same targets in the brain that the opioids would attack. They basically beat them to the punch. Now, Trexone works differently than methadone and buprenorphine. It does not help with withdrawal symptoms or cravings. Some other treatments may include counseling, because these people do need help. They do need someone to talk to. A lot of times they may want to quit, but they just can't on their own. So that's where we come in. You also have what we call medication-assisted therapy, which basically it looks at the person as a whole in a system. So this is a whole system with medicines, behavioral therapies, other treatments, which can increase the chances of a successful recovery. And then we also have residential and hospital-based treatment. All right, ways our community helps. We actually, here at Holidays Helping Hands, we have this program where we have people with opioid addiction or other addictions that come. And in our communities, we have basically rehab centers that we can get in touch with if that patient needs to go. What we're basically doing is providing housing and medical services and social services to these people while they're down on that luck. We have hotlines that we can call. And we have social workers on site, nurse practitioners on site, mental and psych and family nurse practitioners, and also on-site nursing staff. So that is how we are helping the community in this crisis, this national opioid crisis. And now some of my references, they're written down. I hope you enjoyed my presentation. Once again, my name is Jalen Payne, and I enjoyed presenting the national opioid crisis to you. Thank you.